It's a pleasure to be with such a diverse group. And I always think about the problems of communication. George Bernard Shaw said that the greatest problem with communication is the illusion that it's actually occurred. But there's a problem in the same language and in the same culture. A few months ago, my wife, Paula, and I were traveling to San Francisco. We had our 11-year-old granddaughter with us. And in the security lines, they were talking, and suddenly Paula turns to me. She needed help. She said, Oliana just asked what the definition of prostitution is. Well, you know from reading that you're supposed to answer these questions when they come up, but the security line at the Atlanta airport didn't seem the right place. So I asked her, why do you ask? And she said, well, there's a sign back there that says if you give false information, you're subject to prosecution. What does prosecution mean? But there's also a problem with the same language and different cultures. I read about a comedian from California that had a one-week job in Canada. And when he flew there, it's his first time to Canada, he was talking to an immigration officer who asked, where were you born? He said, the United States. He asked him some other questions, and then he said, and what is your occupation? He said, I'm a comedian. The immigration officer thought he said, I'm a Canadian. And he's bewildered. He said, I thought you said you were from the United States. Well, the traveler thinks that the immigration officer is making fun of Americans with no sense of humor. And so he says, but Will Rogers was an American and he was funny. And now the immigration officer is totally confused and he said, what are you, a comedian? And he said, no, I'm from the United States. I became interested in global health 65 years ago. CDC was 5 years old, WHO was 5 years old, and I can no longer remember how I did it, but I was getting literature from both places as a teenager in high school. And when I think back over those 65 years, some of the most pleasurable situations that I've been in have been in groups like this. People of different cultures, diverse languages, where we're sitting around trying to solve a problem. And I came to realize it's the diversity that brings new ideas to the solution. And so savor the fact that you are able to do this. There are other reasons why I'm pleased to be here. One is this is where I used to work, right here at the Carter Center. So I spent a long time, lots of times, in this particular room. When President Carter asked me to be the executive director at the Carter Center, I told him I've spent my life in global health and I do not think I would do well in these other fields. And so I was reluctant to say yes. The next day, President Carter called me and he asked, if I became interested in global health, would you consider it then? Well, of course. And you see what happened and what he's been able to do in global health, in schistosomiasis, in trachoma, in onchocerciasis, in lymphatic filariasis. You think of all of those things. But he also inspires people. He's recruited 2 heads of state from Africa to go into health programs. And he influenced Bill Clinton to go into health programs. And so it is an important thing to understand how public health and politics can commingle and improve both of them. A third reason I'm happy to be here is I like to reminisce, and that's what I'm going to do. Some years ago, the Association for Schools of Public Health did a project to figure out what should the curriculum look like in the future for public health. And they asked if they could interview me, and before they did that, I sat down with a blank piece of paper and I said, I want to start from the beginning as if I don't know anything about this and think through it. And I got that idea from Richard Feynman, who was the best physicist after Einstein. And he was shaving one morning, looking in the mirror, and suddenly it struck him that the explanation given in physics books for why left and right are reversed in the mirror could simply not be true, or top and bottom would also be reversed. And he started all over to try to figure out what happens when you look in the mirror, and he came up with a solution. And when our son, David, was very young, he said to me one day, "I wish I could see you for the first time." And I said, "Why?" He said, "My friends tell me you're very tall," and he said, "I don't notice it, but I wish I could see you for the first time." So I responded to the interview for the Schools of Public Health saying, I think there are three things that we're trying to do at school. Number one is convey a philosophy. Number two, skills. Number three, information. The philosophy is eternal. The skills are for a lifetime. The information is ephemeral. And yet we spend so much of our time transferring information. And so I started asking, what is it that's the basis for these three things? Well, philosophy, it's clear. The philosophy behind science is to find truth. The philosophy behind medical care is to use that truth for a patient. But the philosophy behind global health and public health is to use that information for everyone. Therefore, social justice is the base philosophy for public health. With skills, we were sitting in a village house in Nigeria 50-some years ago when I tried to figure out what do I wish I had learned at school. Because there we were so isolated, so many things that can go wrong. What do I wish I had learned? Well, in public health, the skills are statistics, epidemiology, management. Because the difference between whether a body of knowledge actually changes health or doesn't change it comes down to management. In recent years, I would add political expertise in that category also. When it comes to knowledge, the knowledge keeps changing, but there are certain things that you should strive for. General knowledge, how the world works, history, philosophy, what does this all mean? When Jeff was going to Yale, there was a person there on the faculty by the name of Professor Peligan. He was a theology professor. He was an extraordinary person. But he once wrote that the difference between good and great scholarship is with good scholarship, you can try to figure it out. Where did a person train? Who were their mentors and so forth? But he said great scholarship depends on how much you know outside of your own field. So that's the kind of knowledge to spend time on. Knowledge outside of your field, how the world actually works. The good news is we have been so successful in putting philosophy and skills and knowledge together that in this country, our life expectancy has actually increased 7 hours a day for over 100 years. First time I ever used that in a talk, a person said, "That can't be true." Well, I listened to that person because he was my boss, and he was the Assistant Secretary for Health, and he had a degree in biostatistics, he had a degree in theology, and he had a medical degree. At the end of the talk, he got up and he apologized. He said, "It took me so by surprise, I knew that couldn't be true, and so I had to figure it out for myself." And he said, "It's actually 7 hours and 6 minutes." But you see what's happened in the world. One disease, smallpox, is gone. Two diseases are about to leave, Guinea worm and polio. In my lifetime, I had always hoped to see measles disappear. It may still happen, but it's going to hurry. And when you look at under 5 mortality, when I started, 50,000 children a day were dying under the age of 5. That has gone down from 50,000 to 15,000, still far too many, but a 2/3 reduction. And even poverty. The World Bank tells us that poverty is decreasing around the world and that 250 million people a day are moving out of poverty. I mean, that's just incredible. And you're going to be able to do far more than the people of my generation did. There will be problems. There will be the problem of inequities between countries and within countries. There will be the problem of organizations that are not quite as good as they should be, and I include WHO in that list, not because of them, but because of the rules we set up to guide them. We said you have to have 195 members on your board of directors, 195 ministers of health. Who would run a company with a board of 195 people? And we said the regional offices have to be so strong they can undermine you anytime they want to. And we said every year you've got to reduce your budget. And I once wrote an editorial during a time when the U.S. was not meeting its budget. And I quoted Dolly Parton, who said, "You'd be surprised how much it costs to look this cheap." And Ebola showed us how much it cost to look that cheap. And then you'll be faced with the social determinants of health, and particularly poverty. I mean, poverty is the slavery of today, and everyone in this room benefits because of poverty. We get everything cheaper because people are willing to work at low wages, and so we get our food and our clothes and our travel cheaper. And it means that every one of us in this room has become a plantation owner. And think of that and let it get you angry and ask, how are we going to change this? So are there any burning lessons in my last 65 years that I would like to pass on? I actually have quite a list, but each time I talk to students, I vary the list just to keep it interesting for me. And one of the most frequent quotes I use from Einstein came in handy in January. It was like a kick in the stomach to hear that phrase, "America first." And I immediately thought of Einstein, who said, "Nationalism is an infantile disease." He said it's the measles of mankind. And Democritus, 2,500 years ago, said, "The wise person belongs to all countries, for the home of a great soul is the whole world." That's what you're involved with global health. It's also endlessly fascinating. The Earl of Shaftesbury said that the good that you should be after is to be focusing on the group rather than on yourself. And he said the larger the group, the better the good. Well, you can't get bigger than global health. It will call on everything you ever learn. The president of my public health class 52 years ago, Yemi Ademola from Nigeria, wrote in the yearbook that there is not a field of knowledge outside the interest of students of global health. And it's built on your interest in equity rather than your interest in money. One study concludes that the best predictor of how students will do after their education comes down to two things. Did they have a mentor? And did they have a chance to use their skills under supervision? And I tell you this so that you all put on your to-do list to become a mentor. Everything you do in the future will be because of a coalition. So the leaders in health are not defined by the title. They're defined by whether they can make a coalition actually work effectively. I recall often the words of Norman Cousins 40 years ago. He said, "The greatest gift you can give the world is the idea that it is possible to plan a rational future." And to do this, remember, it's a cause and effect world. Health doesn't improve by chance. It improves because you do things to make it improve. Know the truth. Josh Billings said that the supply of truth always exceeds the supply of demand. And so make sure that your work, you're demanding truth. And know the limitations of science. People from the outside think scientists are so certain about everything. But again, going to Richard Feynman, he said certainty is the Achilles heel of science. and religion and politics. So do not be certain. Voltaire said that doubt is not pleasant, but certainty is absurd. So love science, but don't worship it. There's something better than science, and that is science with a moral compass, science in the service of humanity, and science in the service of equity. The power of science is in its use, not in its existence. Rabelais said 10 words that I think should be in every science building in the world. He said, "Science without conscience is but the ruin of the soul." Number 8, the need for optimism. Harlan Cleveland was a political scientist. He became interested in global health late in life, and he said the fuel of global health is unwarranted optimism. Keep that optimism. And I tell students all the time, don't hire pessimists. They'll ruin your day, they'll ruin your office. And if you actually need a pessimistic paper, contract out for it, but don't get those people into your office. No group has ever had the power that you're going to have. And so I think of William Penn, who was the Quaker leader, and he said, to heal the world is true religion. So spend less time on a life plan, more time on life philosophy, and then you'll have something that helps you at every fork in the road make a decision. Finally, how people treat each other is the measure of civilization. It's the measure of an individual, it's the measure of an organization, it's the measure of a state, it's the measure of a nation, how people treat each other. I'm going to close with something I used last spring when I gave the Emory commencement address. And I told the students that years earlier, our son was a student at Emory, and I was asked to talk to the board of trustees about what did I hope our son found at Emory. I made the mistake the night before to read Kipling. I always liked the way Kipling could put big ideas into small packages. But I read something that was very disturbing. He wrote, and the talk slid north, and the talk slid south, with the sliding puffs from the hookah mouth. 4 things greater than all things are: women, and horses, and power, and war. You know immediately that that's wrong. And I sat there struggling, what do I wish he had said? And so I rewrote Kipling that night for what I wanted my son to hear. And the talk slid east, and the talk slid west. And a student asked, which life is best? 4 things treasure, all else above: purpose and faith and wisdom and love. And then I closed by saying to the students, in the book Cutting for Stone, there is a phrase that once you hear it, you'll never forget it. Home is not where you are from. Home is where you are needed. And I hope you all find your way home. Thank you.